Well, welcome back, everybody. This is Dr. Bulow with Revive Upper Cervical, and we're working on a series on concussions all through 2017 here. And let me make sure I've got the location of my camera right. There we are. I want to make sure I'm talking into the camera today. I've been working through specifically a research article that is called Multidisciplinary Management of Athletes with Post-Concussion Syndrome, and involving a pathophysiological approach. Basically looking at concussions, sports-related concussions specifically. And recently we defined concussion. We talked about how it's this set of symptoms dealing with a lot of times headache and vertigo and mental fog and anxiety and depression and things like that. Now I'd like to talk to you a little bit about what is it that the current community in concussions thinks is happening? Like, why do the symptoms of concussion happen in the first place? And there's just a few things that I want to mention today that this article talks about that I think is hugely important. Historically, concussions were looked at as being simply a functional problem in the brain, meaning the brain cells are not functioning properly, but anatomically they're all there, right? Now there's some changes due to some updates in clinical imaging, MRIs and things like that. And so there's some different theories as to what's going on physically in the brain. Basically there's three main ones that I wanted to bring up and talk about today that I think are really important. One of the big ones is that there's a decrease in the blood flow in and out of the skull. When a concussion happens, the brain gets rattled and the cells get activated, and some of them get damaged. Some of them spill off material outside of the cell when it should be inside of the cell. And due to a variety of factors, the brain needs more blood flow whenever there is a concussion. It needs more of it, but the body cannot give the right amount of blood flow. And this is also seen after a concussion. When an athlete goes to exercise or a student goes to focus and study on their work, that increases brain activity to where the brain requires more blood flow. And whenever they can't perform, whether it be athletically or whether it be academically, the theory is, well, there's obviously not enough blood flow to supply the brain with its increase in demand after a concussion. So blood flow, that's number one. The other issue is that the actual structure of the brain, the cells, how they're shaped, can get potentially damaged. There can be, it's almost like if you had some dry spaghetti noodles and you kind of bent and twist the spaghetti noodle, how it can crack and break and snap. The little fibers that connect the brain can perhaps get damaged. That's a weaker theory, but it's still a theory nonetheless. And then lastly, there's the theory that when the cells get damaged, the cell is kind of like a water balloon, right? It's a contained environment, and the little parts of the cell get spilled outside of the cell. And that's something that we also can see in the cerebral spinal fluid, the brain fluid, and blood flow as a way of measuring whether someone had a concussion or not. So there's three possible things right now that we're looking at structurally inside the brain now. Blood flow is an issue, damage to the cellular tissue, the fibers that connect the cells, and cellular material outside of the cells when it should be inside of the cell. Now there's a fourth on there as well that we talk about every time that we do these videos, and that is that there can be a whiplash in the brain, a misalignment at the point where the skull sits on the neck that can affect, get this now, that can affect the blood flow. So now we look at this and say, well, if there's a tissue damage in the brain, that's something that we probably never will be able to fix that, clinically. That will probably have to be a time thing. The body's just going to have to naturally heal that. But the other two factors that they're looking at medically, the blood flow to the brain and the excess material outside of the cells that needs to be cleaned up and taken out of the brain, that involves two systems in your brain. It involves the blood flow, and it involves the flow of cerebral spinal fluid, the clear fluid that your brain sits in. And those two systems are very largely impacted, or can be largely impacted, by the upper neck. There's research out there with NFL players that when we have a whiplash, a concussion injury, if the neck gets turned or twisted, it can change the amount of cerebral spinal fluid flowing in and out of the skull. The other thing that happens is that the brain stem here is what controls the amount of blood flow in and out of your skull, how wide or constricted the arteries are that go in and out of the skull. And that's our main test in upper cervical work, is we do thermal evaluations. It's a way of measuring the sympathetic nervous system. That's the part of the brainstem that regulates the constriction and dilation of those blood vessels. So chiropractically, we would say, let's look at the alignment, because that's not even on the list medically of what could be going on. But we say, yeah, that could be going on. But then if we look at the list medically and we look at the potential reasons, blood flow, cellular fiber damage, and extracellular chemicals and proteins outside of the cells, two of those three, the blood flow and the extracellular fluids or extracellular proteins that need to be cleaned up, two of those three can be helped by maintaining proper alignment of the spine. So this is an issue that we think is very important, and hopefully it's given you some more information on what's happening inside the brain of a concussion patient. I'm running out of time, running out of battery on my phone today. Hopefully this has brought you some value. If you have any questions, please leave it in the comment sections below. And if you know someone that needs this information, please share it with them. Thanks so much. This is Dr. Bulow with Revive. We'll see you guys next time. Bye now.